Dr. Muhammad Zaqout is the Director General of Hospitals in the Gaza Strip. He's joining us on the phone from Khan Younis. Sir, thank you very much indeed for being with us. The numbers that we have just been hearing are very, very large indeed. How do you make the choice about who it is to get priority when it comes to getting medical assistance outside Gaza?
The situation is very difficult regarding our patients and injured because we have more than 100,000 of injured patients during the war and more than double of this number of patients who cannot receive their medical service because of the war and the attack of the Israelis. They are all the time attacking the hospital and destroy the health system. And we have just remaining 3 main hospitals, which are watch hospitals working. So we did a list of the urgent cases regarding the technical committee, which is working all the time, day by day, and receiving the referrals from the hospitals for the urgent cases, classifying the disease, classifying the cases. About the priority, we have now about more than 6,000 of very urgent patients who are need for evacuation and treatment outside because the treatment is not available. Most of them are severely injured during the war. Most of them, others are cancer patients and other specialties which the treatment and the facilities are not available here in Gaza. So they are on top urgent for referral more than 6,000, and the other 25,000 are remaining for classification B and C about the priority and the case of the diagnosis and the need of treatment outside Gaza.
If I understand it correctly, sir, you and other medical organizations have to submit lists for checking by Israeli forces. Do you find that they generally will clear everybody to go through? Are they rejecting anybody?
We just were asked yesterday to send we sent it to the Egyptian side. And today morning they sent us back the numbers who are allowed, 50 patients. All of them are children. We sent, yesterday we sent 400 patients for evacuation in the same day or second day. But they sent 50 patients of them. And at least one of these 50 are rejected, but the 50 are allowed to pass tomorrow because there was no possibility today to pass the border. We received just at 9 a.m. this list. So we will start to evacuate our patients tomorrow from Shifa Hospital and Nasser Hospital with the help of WHO. And we will put them in ambulances and autobuses and to go through the border in collaboration with WHO. So we contact our patients today, the 50 patients and others who will be allowed. In the other day, we will wait to the Egyptian side to send the list were checked from also the Israeli part, as we know. So we are waiting the number, but they told us that just 50 of our patients will be allowed tomorrow to pass the Rafah border.
So can I just check with you? You were referring to the patients that have been turned back on the lists. The reasons that you are given for those patients not being allowed to travel, in your understanding, is that down to practical efforts, practical situations, or is it down to military considerations?
He is a children, he is not a military, and they don't clarify to us what is the reason. They just put a red line on the name and that he is rejected without clarifying the reason. So he's a children with cancer and he is rejected. Why? We don't know. But they don't tell us about the cause of rejection.
Obviously, as you were saying, 50 patients are going to be transferred on Saturday. That still leaves an enormous number of patients that medical staff in Gaza have to cope with. Can you just explain to us or describe to us the kind of conditions that the medical staff are having to deal with when they're trying to keep people treated after such an extraordinary time of devastation?
During the war, for the first month of the war, about 50 patients of our consultant and doctors left Gaza, and hundreds of them were killed by the Israelis. For example, pathology, for example, they killed 2 of our experts, our consultants, and the remaining is just 2. So this specialty is very, very shortage in it. And we cannot manage also for other reasons, for the shortage of supplies and the drugs. For example, the cancer patients, we don't have radiotherapy at all. We don't have the chemotherapy drug circle because we have just 1 or 2 drugs and lack of other drugs, which is very important to complete the circle of the treatment for the patients. So all the circle, there is a shortage. And the surgical elective surgeries, was no space in the OTs, in the theaters to operate these patients because the destruction of the hospitals and the lack of the staff and expert staff. So the situation of the patients, they are dying silent without dealing with them or from the society.
So we appreciate that this is obviously a very difficult and very stressful time for you and your staff, and we're very grateful to you for taking the time to talk to us on Al Jazeera. Dr. Muhammad Zaqout, thank you very much indeed.
Thank you.
Make sure to subscribe to our channel to get the latest news from Al Jazeera.